So I'm Nancy Evans Begley, professionally, and by day I am a banker and loan officer. By night I'm an actress, singer, and dancer, professionally in the Denver metro area. And I'm also a Weight Watchers and weight loss success story, having lost about 120 pounds at this point. There is a piece of weight loss that people don't talk about. I was an unfortunate victim of excessive, painful, loose skin. Subconsciously manipulating it in the mirror every time I would look at myself getting ready for work in the morning. There was always something that I wanted to change. So my husband commented on it finally, said, "Do you realize that you do this every single time you look in the mirror?" And at that point, we had the conversation about skin removal surgery. My procedure was January 6th of 2015. 6.6 pounds of tissue was removed from my body. It was horribly painful, but now it's the best decision I've ever made. And I have a newfound confidence in my body that I didn't even know I lacked. All of that said, I wouldn't be where I am now, 3.5 months post-op, if I was not referred to a peri-operative therapist. I met the staff at Soulstice, found them to be loving, supportive, genuinely caring about my health and well-being.
At Soulstice, we're massage therapists who specialize in peri-operative therapy, and we work with the swelling, scarring, and postural distortion after a surgery.
We use a wide variety of techniques that we've developed over the years that can help people get back on their feet faster and more efficiently following their surgical procedure.
Prior to my procedure, I had support, and then after, I had appointments once a week at Soulstice to get me back on my feet.
The people that pursue peri-operative therapy may believe in Western medicine, are taking a painkiller or a muscle relaxer to help them through the process, but then they want something else. They want to do something that involves them working towards the rehab process.
And I can tell a tremendous difference in the healing process because I've been doing the homework that my therapist recommended.
Getting their fingers on their skin, on their body, having it respond, and moving that collagen and smoothing things out, it's an everyday job. So they don't need to come in and see us every day. They get to learn how to do it.
The expectation I had going into my peri-operative therapy after my surgery was nothing like what I think people think about when they think of typical massage.
Have you ever had a massage before? And if you said yes, I would say this is nothing like you've ever had before.
This is not a spa necessarily. This is not a deep tissue massage. This is really something to help you heal. This is targeted and focused towards your scar tissue, your incisions.
And after a surgery, you won't want me to touch you. You don't want anybody to touch you.
And this work, especially at the very beginning of treatment, is feather light. It's like pressing a nickel on a countertop.
The first thing we're doing is facilitating the lymph system, helping you move your swelling on so you can start the healing process.
We don't have to work very deeply, and oftentimes people are afraid of that, especially coming in very early on following their surgery.
There's nothing about the work that we're going to do that's going to be painful. The whole idea is to calm your nervous system, calm the brain, and have the brain believe that everything's going to be okay.
There are techniques that are used that are completely different from any other massage that I'd ever had. One being the use of cupping.
So with cupping, we're using a suction cup, and we're pulling fluid and blood flow to a particular area that we're trying to address that is starving.
Through the process of interviewing surgeons, most every one of them said, "Oh, you'll be fine. You'll be fine. 2 to 3 weeks, no problem. You'll be back to work, feeling pretty good." And the reality of that is, yes, you're functional.
It's quite uncomfortable.
But you are by no means in any condition to return to normal activity after 2 to 3 weeks.
I was able to get up a few stairs on my own without help or my walker.
I truly have no idea how anyone going through a surgical procedure could get through it without the support from Soulstice.
When we go and call on doctors, they're like, I don't know. I mean, the body's going to heal itself. And that's when we say, could you just send a client to us? They'll give you a report. And when they see the result, when they see how happy the person is, they come back and they're like, why doesn't everybody do this after their surgery? I mean, they really do see it. They see people healing several days or up to 2 weeks faster than somebody who doesn't use perioperative therapy.
Making the decision to have the surgery I did was a tremendous financial investment. You would be shorting yourself if you didn't complete the process by including perioperative therapy.
When someone plans to do an elective surgery, they've already taken a certain amount of time out of their life and from work. So by investing in perioperative therapy at Soulstice, they're going to get better faster, they'll rehab quicker, they'll feel more energetic and get back to work, which cost justifies the perioperative therapy moving forward.
I could feel a difference within a few days. I actually remember I was feeling puffy and swollen at my first appointment. It was the complaint that I was having. And after my first lymphatic drainage massage, I came back for my next appointment and told my therapist I had lost 5 pounds of fluid. It was completely different than any other massage that I had received in the past.
To have someone's hands on you that isn't poking or prodding or taking blood or giving you an injection, but actually giving healing is very powerful.
There is this mind over matter piece post-op that's exceptionally important, and having Soulstice by my side to be there to support me, to help my body, to even subconsciously allow my mind to relax, which in turn helped my body heal, was exactly what I needed to get back on my feet and feel better very quickly.
Nancy's choice to have this surgical procedure is not unlike the majority of people that we see here. They're people who've really decided to make a change in their lives for whatever reason that is. And Nancy, along the way early on with her post-operative rehabilitation, she was a completely different person than she is now. She really has blossomed into what she always hoped she would be, and she's feeling what it feels like to be in her new body and her new skin and living a life that she was yearning for on a number of levels.
I am 3.5 months post-op, and I auditioned for West Side Story 2 weeks ago, had 4 very intense dance auditions, and am thrilled and honored to be playing the role of Anita, which is a heavy, heavy dance role. I remember my therapist at Soulstice telling me, oh, very definitely by 3 months you should certainly be well enough to audition for that show. And I was really hesitant. I didn't believe that it would be possible. I was semi-functional, semi-dysfunctional, in some pain still. But that confidence that my therapist had in me, I said, I'm gonna do it. I'm gonna go out and do it. And I did it. There is no price tag for this kind of support. And the way I feel about myself now will change my life forever. I have nothing but gratitude for Soulstice and everyone there. I made the directors cry for West Side Story because they all kind of know about all of this, and they just looked at me and said, oh, we've never seen anybody work as hard. We've never seen it. This has not been an easy journey. It's one that I'm continuing. It's the most rewarding journey I've ever had in my life. And the beauty of it is it never has to end.